AIDS was first clinically discovered in the US in the year 1981. It was first seen in injection drug users and also gay men that had no known source for an impaired immunity, and was officially named AIDS in the year 1982. But before that, it was named GRID or gay-related immunodeficiency, and then named to 4H because it was found in homosexuals, heroin users, hemophiliacs, and Haitians, and was finally named AIDS. The virus causing AIDS was named HIV in the year 1986. The virus is believed to have originated in Western and Central Africa, with acts of bushmeat hunting and eating. Graph shows data about the HIV/AIDS worldwide. The green line represents the number of people living with HIV/AIDS. The red line represents the newly infected, and the blue line represents the death from HIV/AIDS. The green line is steadily increasing because there is no known cure for the disease. The red line has decreased because of increasing awareness and public campaign. And the blue line has decreased because even though there are no known cure for the disease, there are antiviral drugs that can help the immune system to get strong and to fight off the virus.
In HIV transmission, there are two main means of transmitting the virus: sexual intercourse and the sharing of needles, syringes, and other drug injection equipment with HIV-positive people. Sexual intercourse and drug injection equipment sharing are the main means of transmission because HIV is transmittable through body fluids like blood, breast milk, semen, vaginal fluids, cervical fluids, and anal fluids. These fluids can transmit HIV if they get in contact with the body's mucous membranes, damaged tissues, or when they are injected in the body's bloodstream. Mucous membranes are present in different body openings such as the inside of the nose, urethral openings, the vagina, and the anus. Other ways of transmission include blood transfusions and organ or tissue transplants where the donor is HIV positive. A mother can transmit HIV to her infant via perinatal transmission, where the mother transmits HIV to her infant during pregnancy, while in labor, in delivery, or through breastfeeding. The signs and symptoms of HIV differ based on the stage the person is in. In the first stage, called acute HIV infection, they can appear as early as 2 weeks after contraction, characterized by a flu-like condition among others. The next stage is called chronic HIV infection, which lasts for 10 to 15 years without HIV treatment. This stage sees the infection lowering your T cells in the body and slowly increasing the presence of the virus in the body. Signs and symptoms may not appear and the person may not feel sick. After a transitional stage called symptomatic HIV infection, the final leading stage is finally acquired immunodeficiency syndrome or AIDS. AIDS is characterized by the immune system being severely compromised with the occurrence of signs and symptoms along with opportunistic infections that may lead to that which are considered to be AIDS-defining. An example of these AIDS-defining conditions is esophageal candidiasis, an opportunistic fungal infection in the esophagus. When testing for HIV, a window period is followed. A window period is a time between the first suspected infection of HIV and when the test can reliably detect the infection changes in the body. There are different tests that can be conducted for diagnosis. For antibody tests, which detect antibodies made by the body in order to target HIV, there are two notable tests: ELISA, or the enzyme-linked immunosorbent assay, and the Western blot technique. Both have the primary objective of having a person's blood applied to a plate with HIV antigens attached. Other tests are antigen tests, nucleic acid-based tests, a combination of antibody and antigen tests, and rapid HIV tests. For someone to be diagnosed with AIDS, one would need to have a CD4 positive T cell count under 200 cells per microliter, a CD4 positive T cell percentage of total lymphocytes of less than 14%, or one of the AIDS-defining conditions mentioned earlier. The treatment and prevention of HIV have the overall goal of controlling the infection and improving the quality of life of HIV-positive people. Highly active antiretroviral therapy, or HAART, is the usage of different antiretroviral drugs that maintains the patient's immune system, prevents or treats infections, and reduces the risk of transmission of the virus to other people. There are different types of antiretroviral drugs, an example of which are entry inhibitors. There's also antiretroviral combination therapy, which defends against resistance by suppressing HIV replication. These are present in fixed-dose combinations or multiple drugs combined into one pill in order to ease the pill burden. Antiretroviral therapy also helps people have an undetectable HIV viral load which lowers the risk of transmission of HIV via sex to virtually zero. These drugs are also present in preventing the perinatal transmission of HIV and in pre- and post-exposure prophylaxis. There are no vaccinations available for the virus, although one can be treated with experimental medicine when in clinical trials.
Reporting natin is the general structure of HIV. So, next slide natin is the electromicrograph of HIV virus. So, etong picture na to is na-taken noong 1983. Ito yung unang electron picture na nailabas. So, kitang-kita nyo naman na ang laki ng virus na to isang retrovirus at may laki lamang siya na 100 nanometer. So, next slide natin is yung structure na mismo ng virus, yung representation. So, itong HIV virus na to is called retrovirus kasi nag-i-insert siya ng genetic information using RNA. Yung outer shell niya is the lipid envelope na nag-derive galing sa isang host cell membrane na dati niyang host. So, etong lipid envelope na to ay nagsiserve as protection from the extracellular environment, pati na rin at ginagamit itong virus na to para mag-navigate through endosomal membrane trafficking. So, meron din siyang abilidad na para pumasok sa isang host cell gamit yung kanyang mga glycoproteins, yung mga patusok-tusok. So, etong lipid envelope na to is yung now-covered siya ng mga spikes na may trimeric transmembrane glycoprotein tulad ng GP120 at GP41. So, etong dalawang to, ito yung mga nag-fuse sa CD4 receptors ng CD4 T cell para maka-enter siya sa host cell. Pagka fuse niya sa mag-anchorage yung GP120 sa host cell para magamit pa ulit para sa susunod na replication. So, etong lipid envelope na to, etong mga glycoproteins na to, isa sa mga na invento ng mga scientists na para antiretroviral, para hindi kumapit yung antiretroviral drugs, meron silang tinatakpan nila yung mga glycoproteins para hindi kumapit sa mga receptors. Isa to sa mga gamot na iniinom natin ng mga HIV survivor ngayon na para mabuhay ng parang normal. So, at hindi maging AIDS. So, eto yung sunod ng structure sa lipid envelope is yung P17 matrix protein. Ito yung nasa gilid. Parang mga bilog-bilog. So, etong protein na to, nagme-maintain siya ng structure ng virus at ginagawa na rin itong protection para maprotektihan yung capsid. So, yung capsid naman, ito yung conical shape structure. Para siyang cone na nagproprotekta sa dalawang strand ng positive sense viral RNA genome at kasama ng mga enzyme na protease, integrase at reverse transcriptase enzymes. So, etong P17 proteins na to, ito yung nagproprotekta. So, pumunta naman tayo sa RNA. Ito yung RNA, ito yung naglalaman ng kanyang genome. So, itong genome na to, nagpa-facilitate para sa translation ng DNA into proteins. At meron itong 9 genes na i-discuss sa susunod na reporting. So, tapos itong proteins, ito yung nagbe-breakdown ng mga large proteins into smaller proteins para mabuo ang HIV genetic material para mabuo ang isang HIV virus. Without effective HIV protease, HIV virion remained uninfectious, according to Cross-Leach studies. So, doon naman tayo sa integrase. Itong integrase na ito yung nagdidikit sa RNA at yung kinapin ng reverse transcriptase para maging DNA siya at didikit niya sa DNA ng isang host cell.
The next part of the report will be about the genome structure of the human immunodeficiency virus. The HIV genome consists of two identical single-stranded RNA molecules that are enclosed within the core of the virus particle, as shown in Figure 1. The genome of the HIV provirus, also known as proviral DNA, is generated by the reverse transcription of the viral RNA genome into DNA, degradation of the RNA, and integration of the double-stranded HIV DNA into the human genome. The DNA genome is flanked at both ends by the LTR, or long terminal repeat sequences, as shown in Figure 2. The 5' LTR region codes for the promoter for the transcription of the viral genes. In the direction 5' to 3', the reading frame of the GNAG gene follows, encoding the proteins of the outer core membrane, the capsid protein, the nucleocapsid, and a smaller nucleic acid stabilizing protein. The GAG reading frame is followed by the POL reading frame coding for the enzymes protease, reverse transcriptase, and RNase H or RT plus RNase H, and integrase. Adjacent to the POL gene, the ANV reading frame follows, from which the two envelopes glycoproteins GP120 and GV41 are derived. In addition to the structural proteins, the HIV genome codes for several regulatory proteins, TAT or transactivator protein, and REV or RNA splicing regulator, which are necessary for the initiation of the HIV replication, while the other regulatory proteins NEF or negative regulating factor, VIF or viral infectivity factor, BPR or virus protein R, and VPU, virus protein unique, have an impact on viral replication, virus budding, and pathogenesis. The next part of the slides shows the overview of HIV-1 proteins and their respective function. The numbers correspond to the size of the proteins P or glycoproteins GP in 1000 DA.
The last part, the reporting, is all about the current global situation of HIV and its possible future. As of 2018, the statistics conducted by WHO or World Health Organization shows that 37.9 million are infected with HIV. Those numbers have majority being 15 to 46 years old of age, and in terms of mortality rate, 770,000 have died because of HIV-related cases in year 2018 alone. If we will combine the total cases of HIV since the epidemic began up to 2018, 75 million patients are infected with such virus, and 30 million have already died. HIV still doesn't have a cure yet, but there's a therapy for related medical cases that are currently being offered to the public. The treatment is called ART, short for antiretroviral therapy, and 60% of the HIV patients are already receiving such treatments. The treatment that they receive is somehow help to ease their discomfort dealing with HIV. Regardless of not having a cure, there are already two people who overcome and were cured from the virus. The first patient is Timothy Ray Brown, or the burden patient. He is said to be healthy through intensive round of chemotherapy and radiation and 2 bone marrow transplants. Adam Castillo is the second patient. He was cured from another way. This time, it is because of stem cell transplants. However, both of them still have the remnants of the virus in their body. Because of the different scientific breakthrough, together with increasing access to HIV-related diagnosis, HIV became more manageable chronic condition. Thus, there might be more improvements in the near future that allows people to have a longer and healthier life. Also, art are becoming more accessible for HIV patients around the world. This might be indication that we are close to a vaccine for HIV.